وكلي لأن عبرت
Today, I'm going to talking about the liver. The liver is found in right upper quadrant of the abdomen. It is relatively much larger in the fetus and child. The human liver weighs approximately 150 grams and comprises about 2% of the total body weight. The liver assumes the shape of the cavity it occupies. Location of the liver. The liver lies mainly in the right upper quadrant under the cover of the 7 to 11 rib, from the right side occupying predominantly the hypochondrium and the epigastrium. Ligaments of the liver. We have four ligaments of the liver: the round ligament, falciform, left and right triangular ligament, and coronary ligament. The round ligament, it is the remnant of obliterated umbilical vein. This is the falciform ligament that separates the left lateral and left medial segments along the umbilical fissure and cord the liver to the inferior abdominal wall. This is the falciform ligament. Right and left triangular ligament that secure two sides of the liver to the diaphragm. This is the triangular ligament. Coronary ligament, extension of the triangular ligament anteriorly on the liver. This is the coronary ligament. Surface of the liver, we have two surfaces of the liver, the diaphragmatic surface and the visceral surface. The diaphragmatic surface is smooth and flat posteriorly and has a smooth rounded upper surface with a large dome for the right and a small dome for the left. Inferior border of the diaphragm surface marked by the notch of the gallbladder and notch for the ligamentum teres. The inferior surface is formed by the letter of H. The arm of the letter formed by the gallbladder and the inferior vena cava. Other arm formed by ligamentum teres and ligamentum venosum, while the center is formed by the porta hepatis. Relation of the liver, as we see in the photo, the liver is relation in the visceral surface to many organs, and this includes the first, stomach and duodenum, second, esophagus, third, lesser omentum, fourth, gallbladder, fifth, right colic flexure, and finally, sixth, the right kidney and right suprarenal gland. Local and segmental anatomy of the liver. Segmental liver anatomy. The liver is comprised two functional independent right and left lobes. The plane of division between these two lobes called the principal plane. On the visceral surface, the principal plane is defined by the inferior vena cava superiorly and the gallbladder bed inferiorly. The middle hepatic vein lie in the principal plane and drain from both lobes. The old anatomical description of the liver as having a large right lobe and a small left lobe separated by the falciform ligament define the anatomical left lobe as consists only of 2 and 3 segments. But now in current terminology, the left lobe includes also the caudate and the quadrate lobe. The caudate lobe, which lie between the inferior vena cava and the fissure of the ligamentum venosum, while the quadrate lobe lying between the gallbladder and the fissure of the ligamentum teres. Radial lobe is important variation. It is a tongue-length extension from the right hepatic lobe. It is not considered as a true accessory lobe of the liver, but anatomical variant of the right lobe of the liver. Male to female, approximately 1 to 3. Radial lobe is an important variant to be aware because of it is simulate a mass. Coinode classification. The coinode classification of the liver anatomy divides the liver into 8 functionally independent segments. Each segment has its own vascular inflow, outflow, and biliary drainage. In the center of each segment is a branch of the portal vein, hepatic artery, and bile duct. This is the segmental anatomy of the liver. The classification system uses vascular supply of the liver to separate the functional unit from 1 to 8. Right hepatic vein that's located in the right intersegmental fissure divides the right into anterior and posterior, while the middle hepatic vein lie in the mid-lobar fissure divides the liver into right and left. The left hepatic vein located in the left intersegmental fissure that divides the left lobe into medial and lateral. The portal vein divides the liver into upper and lower segments. The left and right portal vein branch superiorly and inferiorly to project into the center of each segment. This is ultrasonic picture that's showing the inferior vena cava, the left hepatic vein, middle hepatic vein, and the right hepatic vein, and the segment of the liver 2487. This is computed tomographic image of hepatic vein of common liver segment. The image shows the three hepatic vein and inferior vena cava. This is inferior vena cava, left hepatic vein, middle hepatic vein, and right hepatic vein. And the segment as follows: 2, 4, 8, 7. And at the lower level, 3, 4, B, 5, 6. The blood supply of the liver. Blood supply. The liver receives dual blood supply from the portal vein, which compromise about 75 to 85%, while the hepatic artery compromises 15 to 25%. The hepatic artery, it is a branch of the celiac artery. Common hepatic artery passes over the head of the pancreas and the right gastric artery, then gives a gastroduodenal artery at the epicute foramen to become a hepatic artery proper. The hepatic artery continues in the free edge of the lesser omentum, anterior to the portal vein and to the left of the common bile duct. Divides into left and right branch in the porta hepatis. This schematic picture that's showing the celiac trunk, the splenic artery, and the left gastric artery. And this is the hepatic artery that gives rise to the right gastric artery and the gastroduodenal artery, and then becomes the proper hepatic artery. And the porta hepatis is divided into right artery and left hepatic artery. The portal vein that provides 85% of the blood supply to the liver, formed by the union of the splenic vein and superior mesenteric vein, posterior to the neck of the pancreas at the level of L1, L2, runs at posterior aspect of the free edge of lesser omentum to the porta hepatis. It lies posterior to the hepatic artery and the common bile duct. This picture showing the main portal vein, the left portal vein on the right after that divides into right upper, right inferior portal vein and right posterior portal vein. This picture also shows the portal vein that's formed by the union of the splenic vein and the superior mesenteric vein and enters through the porta hepatis. Venous drainage. The liver drained by the hepatic vein to the inferior vena cava. Right, middle, and left hepatic veins right to the corresponding third of the liver. The middle hepatic vein lie in the principal plane and may unite with the left hepatic vein and have a common final course to the inferior vena cava. Hepatic vein have no valves. This picture showing the hepatic vein, right, middle, and left, and drain to the inferior vena cava. Caudate lobe. The caudate lobe derives its arterial supply from the both right and left hepatic artery and both portal veins, and it is venous blood drained directly to the inferior vena cava. The lymphatic drainage. Lymphatic accompany the portal vessels and duct drain into the node and the porta hepatis. To hepatic node along the hepatic vessel duct, then to the lesser omentum, retropyloric node, and then to the celiac node, and finally to the sternatrial. This picture showing the lymphatic drainage of the liver. Imaging modalities. Plain film of the abdomen. The margin outlined by fat. Thus, the lateral border can be seen when the flank is lined by the properitoneal fat. The intraperitoneal and omental line the inferior border. This border is best seen in obese, whose visceral surface tend to be less steep and more tangential to the beam on AP view. The lung outline the pleura and diaphragm over the upper limits of the liver, but the gas of the stomach may give a misleading impression of the position of the inferior border of the liver, as the stomach may pass posteriorly to this border. Ultrasound, as the liver is a solid organ, so it has a smooth contour and soft structure, can be appreciated as it moves up and down with the breathing.
كملتوا؟ يلا بالخير بالخير، ارجعوا ارتاحوا اليوم، ارجعوا ارتاحوا.
The vessel and bile duct
يلا نعمل
are particularly
يلا نعمل الحمد لله. يلا معك.
The liver is used as an acoustic window for visualization of other structure, including right kidney and adrenal gland, the gallbladder, and pancreas. The blood flow can be studied using color Doppler, and the direction and velocity of the flow on the portal vein can be also evaluated with pulse wave Doppler. This is ultrasound picture showing the common bile duct, the hepatic artery, and the portal vein. This is called the Mickey Mouse sign, and also the inferior vena cava. Another picture showing the caudate loop and the ligamentum venosum. And this picture showing the anatomy, including gallbladder, extrahepatic bile duct, the portal vein, hepatic vein, and the inferior vena cava. And this is picture of ultrasound showing a common problem of the liver, including the fatty liver that's showing increased ecogicity and increase the size of the liver compared with the kidney, and also the cirrhotic liver, which is small in size and irregular outline with coarse texture. CT scan of the liver. The CT, a single-phase portal phase contrast enhanced CT. It is the technique for the majority of the routine liver CT imaging. The liver is imaged during the peak of parenchymal enhancement, this being about 60 to 70 seconds after the start of the bolus injection. Oral contrast may be given, but is not necessarily if the liver is it is only liver being investigated. Flash thickness should be 5 millimeter or less. This picture showing the anatomy of the liver. This is the caudate loop, and this is the portal vein, the right lobe of the liver, the inferior vena cava, two adrenal gland, and the two crus of the diaphragm. This is a case of 55 years old female patient with colorectal carcinoma undergoing colonic resection. The contrast enhanced CT showing a 3 hypodense lesion in the liver that suggests a metastasis. This is the hypodense lesions. Multiple facing contrast enhanced CT. The triple phase and the quadruple phase. The triple phase consists of early arterial from 20 to 25 seconds, late arterial phase 35 seconds, and portal venous phase after 60 to 70 seconds, appropriate for hypervascular metastasis. The quadruple phase delay or equilibrium phase at 180 seconds for primary liver tumors. This is a multi-phase contrast enhanced CT 55 years old woman with cirrhosis. A. There is a lesion in the posterior hepatic lobe, but it is not visualized in an enhanced CT. B. Showing the arterial phase, which demonstrates an arterially enhanced lesion that raising the suspicion of hepatocellular carcinoma. C. The lesion become iso-enhanced in the portal venous system with a clear washout. D is a 3-minute delay phase, demonstrate a clear washout and clinch the diagnosis of hepatocellular carcinoma. If examination was terminated prior to obtaining the delay phase, the diagnosis of hepatocellular carcinoma could not be made. Magnetic resonance imaging. On MRI, the liver is of equal signal intensity to the pancreas and higher on T1 and lower on T2 weighted image than the spleen. The hepatic arteries are less well seen unless the intravenous contrast given. On a T2 weighted image, the ligamentum venosum and ligamentum teres are of low intensity, but the fat within their fissure is of high intensity. This is a picture of MRI of the liver that's showing the hyperdense gallbladder, the devoid of signal, the hepatic artery, and the portal vein. Hepatic arteriography. This is achieved via the aortic and stellic trunk with the greater selectivity of contrast agent is injected distal to the origin of the gastroduodenal artery. The frequency of variation of the artery may make injection of the superior mesenteric and left gastric artery also necessary. This is a hepatic arteriography that shows number 1, the common hepatic artery, 2, the proper hepatic artery, 3 and 4, the left and right hepatic artery. 5 is the gastroduodenal artery, 6 is superior pancreaticoduodenal artery, and 7 is the right gastroepithelial artery. CT angiography. In this technique, the CT is performed approximately 60 seconds after selective injection of the superior mesenteric artery. The image acquired in the portal venous phase. This technique was more commonly performed preoperatively and was used primarily to identify the liver tumor or metastasis in patients being considered for resection. In approximately 10% of individuals, portal perfusion defect, the area of no enhancement in segment 1 caudate and gallbladder bed and around the falciform ligament can be seen on CT angioportography. This have been shown to be produced by non-portal venous inflow drainage directly into subsegmental hepatic parenchyma. This is a picture of a CTPA for 48-year-old man with cirrhosis associated with hepatitis B. CT arterial portography scan can show hyperdense enhancement of the caudate and posterior segment of the right hepatic loop hotspot, which could obscure the underlying neoplasm. This is the hyperdense area. Portal venography. This may be achieved by many routes within the liver of the left portal vein, passes anteriorly before running to the left, and oblique view are therefore necessary to view this part of the vein before it turns to the left. A recurrent branch passes to the right to the quadrate lobe, and this should not be mistaken for the right portal vein if the actual right vein is obscured. This is a picture of the venography, liver venography. This is the splenic vein, the main portal vein divides into left and right portal vein. Liver scintigraphy, technetium 99 silver colloid. This showing the reticulum endothelial cell of the liver, spleen, and bone marrow. And this case showing image obtained from a patient with well-differentiated hepatocellular carcinoma in the liver. Thank you very much. We have a quiz time. الكويز استاذ.
احنا وياكم.
اي.
محاضرة كلش حلوة وغطيتوا تقريبا كل الموضوع وبشكل مختصر وكلش حلو. هسه نبدأ بالكويز. أحمد ماجد موجود؟
نعم أستاذ موجود.
أحمد ماجد.
نعم أستاذ.
حرف A شنو؟
الأي الليفت هيباتيك أرتري.
ليفت هيباتيك أرتري. جيد. B فرح زهير.
نعم أستاذ، هذا الكمن هيباتيك أرتري.
كمن هيباتيك أرتري. جيد. مرتضى سي 20.
نعم أستاذ. أستاذ هذا الجاسترو إبيبلويك أرتري.
جاسترو إبيبلويك أرتري. مروان دي.
أستاذ هذا الجاسترو ديدينال أرتري.
جاسترو ديدينال أرتري. عزام.
نعم أستاذ، هذا الرايت هيباتيك أرتري.
أستاذ رعد ويانا؟
إيه وياكم.
يلا أستاذ رعد.
نروح على اليمين. محمد حسن شكر.
نعم أستاذ. This is segment A, segment 2 of the liver.
segment A هو segment 2.
Yes.
أوكي. تمارا.
نعم أستاذ. كوديت لوب segment 1.
segment 1 اللي هو كوديت
لوب.
إيمان فلاح.
نعم أستاذ. segment 7 superior anterior posterior.
أوكي. فرح زهير دي يا سيجمنتال.
segment 8 أستاذ هذه.
segment 8 بالضبط. عندنا أخير شيء أحمد ماجد إي. أحمد محمد جاسم.
نعم أستاذ، هذه segment 5A.
segment 5A. أوكي.